All right, so we are recording right now. It is August 17th, 2021, and I'm using this session as a way to go through the standard operating procedure before we start school. And no, I know that some of you have already started school. So just that's kind of setting up what we're doing here. This is current information based on what I have right now. As we learned last year, things change, and we need to be willing to change as well. So this is current as of August 17th. And my plan is to just go through the standard operating procedure. I have a little presentation that just kind of broke it up into the sections that it is divided into in the SOP. And at the end, I am going to just touch on a couple of other things. I would ask that you please keep yourselves on mute because we do have a significant number of people here, and I want to be able to get through the whole SOP. And where it's going to be recorded, I want it to just be me presenting what I know, and what we'll do is follow up this session with answers to the questions if they were not addressed by what I'm going to talk about today. So I'm going to mute myself for just a moment while I get myself situated. All right, I apologize there. I'm out of practice with this Zoom stuff and presenting. You have to be nice to me. All right, so let's just open it up as a presentation to get the full screen. All right, so forgive me for, I'm going to be looking back and forth. I am recording this session, as I said. I want to just double check that it is recording. Yes, okay. What we're going to be talking about today is the standard operating procedure, and let's get on with it. All right, so looking at the different sections of the SOP, the first section is the background, purpose, and rationale. I think that this is fairly straightforward, nothing new here, but we know that COVID-19 has caused this horrible pandemic that we've all been living through, and this framework, the SOP, is a way to a framework for responding to that. And the overall, the goal is to control the spread, identify outbreaks quickly, and make improvements if we can. So the methods that are used in the SOP, and so this is with case investigation, as well as what we are kind of following is the CSTE case definitions, and that you can find the most recent one at that link. And yes, I will send you these slides when we are all done. That case definition is just, remember the list of disease, the list of symptoms, and how you might qualify as meeting the case definition or not. So as we identify a case, what's the next thing that happens? Well, the school notifies, gives a notification, right? So the school, first of all, I want you to note that the school should notify, your school community should notify its community about that you'll be following the standard operating procedure that's created by Maine CDC, and that all close contacts will be uploaded into the Sarah Alert system and monitored for symptoms. Now, this is a change from last year. A family can opt out, but it's going to be done on the other end. So on your, as far as you're concerned, everyone is being uploaded, and then they will opt out from the system once they're enrolled. So that is a change. Now, you'll notify Maine CDC of the positive case, and you can do that either through the case reporting form or through calling the 624-6717, that COVID hotline number. And that form goes directly to Maine CDC as well as DOE. Just remember that a school would need a point of contact, not the school, the case investigation team. So Maine CDC will need a point of contact from the school. That can be the school nurse. It isn't always the school nurse. It could be a principal or someone else. But that needs to be indicated on the case report form and with a phone number on how they can follow up and reach you. It's best if you have a couple of phone numbers. So if they don't get to you, case investigators don't end work at 3:30 like many schools do. So it would be good if they had a phone number to reach you outside of those hours as well. And then noting that the specific nurse role on within the standard operating procedure is the person that is, the nurse really needs to be the one communicating with the sick person, right? So the person that is the case. They should be notifying, educating them on isolation, proper isolation in the home, monitoring for worsening symptoms, and providing that education for the family on how to isolate the sick person from the rest of the family. That's really the nursing specific part. So at any time, the school is going to call and notify of a case, right? You're going to identify close contacts. You're going to inform those close contacts of exposure and recommend testing and quarantine as appropriate. And as I'm saying, like I just said, this informing close contacts of exposure and recommend testing and quarantine, that is not a nursing specific role. That can be you can have some identified helper people in your school. It can be a school secretary, an ed tech principal. And once you have identified all those close contacts, you're going to submit them through the contact tracing email in an XLS format. So that can be a Google Sheet or an Excel spreadsheet. So I am kind of whipping through the SOP here, and mostly because this stuff is all fairly straightforward. The biggest concerns and questions come with a later section. So just know that I know that I'm going kind of fast through this. So there are different options for laboratory testing. The antigen or a PCR test will open a case investigation with Maine CDC. So they will identify them as a case. Antigen tests are still called probable cases, but they are still investigated, and you will still do contact tracing, and you will do all of that with those antigen tests and with the PCR tests. Maine CDC will not investigate an at-home test. So if someone calls you or provides an at-home test that is positive, I would recommend you either refer them to a testing facility, or if you're able, you can test them yourself with a Binax now and be able to report it that way. Now, even though a PCR confirmation is not required for antigen tests, an outbreak will not be opened unless there are at least 3 PCR confirmed cases in 14 days within your school. That is the same as last year. That has not changed. So school-based testing options you have. I'm not going to go through all of the testing options and the details of the testing options. That's not the intent here, but you do have 2 options. You have pool testing and you have Binax Now antigen testing. So those are the 2 options for testing in the school. Now with isolation, so when talking about your positive case will need to isolate until they meet the criteria for release. Now, the criteria I put in this this visual that Maine CDC has created, and the link to this is right in the slide. It probably looks very familiar to many of you, but the isolation ends when at least 10 days have passed since your symptoms first appeared, and you have no fever for at least 24 hours, and the other symptoms have improved. They have to be improved. They don't have to be gone. Someone who never had any symptoms has to be at least 10 days from the date that they were tested. So the date that they were swabbed is the counting day, and that is day 0. So onset day is day 0. All right, moving along to quarantine. Let me get to the right page. I'm flipping through the physical pages as well as looking at my slides. So quarantine, any close contact must be notified if they had exposure. And remember that a close contact is within 6 feet for 15 minutes. That's cumulative. And I failed to write in, as I was making these slides an hour ago, that, or direct physical contact, that can also be, that would also qualify as being an exposure. So within 6 feet for 15 minutes or more, and or direct physical contact. And all of those that meet that definition of a close contact should be notified that they were exposed, regardless of whether or not they have to quarantine. They should be notified that they were exposed. All right, so here's the messy stuff, okay? So this is, if you're following along on your SOP, this starts on page 5 of your SOP. It is section F, and it is isolation and quarantine section. And these are the exceptions to quarantine. So we know a couple of them, right? They're existing. We knew about those first 2. They're fully vaccinated. They do not have to quarantine if you're fully vaccinated. There is a recommendation from the federal CDC that a fully vaccinated person be tested 3 to 5 days after exposure and mask until they provide that negative test. That is a recommendation. It is not a requirement. So that's your fully vaccinated. They don't have to quarantine from the community. They don't have to quarantine from school. They do not have to quarantine. Another exception, exception number 2, is previous positive COVID-19 cases. So they were positive within 90 days. So if they're in that 90-day window, that's their, as we referred to it, I think last spring, was like the get out of free card, right? Get out of jail free. That's your 90 days. The second 2 are a little bit more nuanced. One is if this student or staff participates in weekly schooled testing, and this is if it's a school exposure. So if they are identified in their school as a close contact and they participate in pooled testing, they have an exception to quarantine. And we'll get to the details of that in just a second. The 4th exception is that the school has a mandatory masking policy, and that is about quarantine, classroom exposures only. So exposures that happen in the classroom setting. Exposures due to busing, exposures due to the cafeteria. That doesn't apply here. All right, so let's look at the chart, which is on page 6, this table 2. And take a deep breath. It's a lot to process. So the first 2 exceptions are vaccination and pooled testing. As you can see with the first 2 rows, the row 2 and row 3, there's no quarantine, no quarantine, and they just have to be notified that they were exposed. So that's what you're doing, right? Then we have pooled testing. Is your school, and you might not even have to look at pooled testing, because if your school's not doing pooled testing, this isn't an option for you or for any of your close contacts. So if your school is doing pooled testing, is this person that is identified as a close contact participating in pooled testing? If that answer is yes, then they do not have to quarantine from the classroom. They do not have to quarantine from school sports or school activities, but they do have to quarantine from the community. And they will only get a letter. They will get notified from you that they were exposed, and they will be educated of this, that you need to quarantine outside of school and school activities. There is a sample letter. It needs to be tweaked a little bit in the appendix on that piece. Like I said, it needs a little bit of editing, and that's hopefully happening this week. And they will not be on your close contact list that you submit to DOE. So that's the pooled testing exception. You will not include them for Sarah Alert. They will not be uploaded into Sarah Alert. They just get some education from your school, and that's it. Exception number 4 is, does your school have a universal masking policy? Policies are going to look a little bit different in every school, but if you have a universal masking policy, which is to say that in the classroom setting, your kids, students are masked. That's the expectation. So when they're in the classroom, they're masked. If that's the case, then, and that person is identified as a close contact from that classroom exposure, they do not have to quarantine from school day activity, school day. So they don't have to quarantine from their education. They can do everything from the beginning of the school day until they go home, till the last school bell rings at the end of the day. Anything that happens within that time, they can participate fully. They cannot participate in after school activities. So that includes your sports, that includes drama, that includes any after school extracurricular activities. And this person would be included in Sarah Alert. They would get uploaded into Sarah Alert system. So that's students. I do want to just make note here that it says that staff still have to quarantine, but we know that staff don't actually, if they can be, there are several options for staff. They can be deemed essential employees, like you don't have any subs to cover this person, and they're going to come to school and come to work anyway. Or you can serial test using Binax now every day, testing your staff, and they could still come to school. So this staff one is a little misleading. Then the last one is that this person has no that the person has no exceptions, that they have no exception, they have no exceptions to quarantine, so they're going to have to quarantine from everything. All right. I think I want to, yes, okay. What I wanted to look at when you're doing your contact tracing, individuals who fall into exception 4 will be listed as a close contact on your contact tracing template and be submitted to the DOE contact tracers. Remember, when we're identifying close contacts, that we're doing that in the classroom, we're doing that in the cafeteria, we're doing that on the bus, we're doing it outside at recess. On the bus, we are only using within 6 feet for 15 minutes or direct physical contact. There is no reference to windows or anything like that on the bus. Outside at recess or soccer practice, any of those things, it's the same definition, that is within 6 feet for 15 minutes or direct physical contact. So I would ask that when you are submitting those close contacts, that you use the most recent contact tracing template, just because we know that things have to be tweaked as we move through and we find out maybe this didn't work the way we thought it was going to work. So the most current version of the template will be emailed to you in that confirmation after you report a case. That's one way to get it, or it's on the COVID-19 toolkit on the DOE's page, and it's on the right-hand side. While you're doing contact tracing, you can always call the hotline 624-6717, or the Maine CDC line, the general number 1-800-821-5821. I'd ask that while we're going through this, if you have questions, please put them in the chat. All right, so notifications and communication is the next section of, there's a lot of tables in the SOP. But notification, case investigators. So this is from the Maine CDC side. The Maine CDC, when they identify a positive case, they must inform the school if this case was physically in attendance during their infectious period. So the infectious period is defined as the 2 days prior to symptom onset or prior to the swabbing date. Case investigators are encouraged to inform the school if the case was in attendance during their exposure period. Now, what we found last year was that they were pretty good about it, notifying you when there was during the when they were there during their infectious period. But as the caseloads increased, as the numbers increased, they were less able to talk to the school when it was just during their exposure period. Remember that schools will report cases using the reporting form, and I've linked that here for your information. It is also always in my email signature. So if you just look at the last email that you got from me, there is a positive case reporting link in my signature. There are sample communications for families and communities in the appendix. I'm just looking through the questions real quick to see if I can. One, I lost my question that I was going to respond to. Oh, the direct contact, direct physical contact. There is a definition in the glossary, and yeah, it is touching each other. If they're physically touching each other, that is direct physical contact. All right, I'm going to move on so that I make sure I get everything before I. All right, that's the end of the standard operating procedure review. I know there are a lot of questions. I'm going to just go through the rest of my stuff, and then we'll go back to, I'll try to address questions that are in the chat. So some other resources that have been updated. The pre-screening tool is finally posted. It is on the toolkit under school health resources, and we are just waiting for our translations to come back. And as soon as those are back, they'll be posted there as well. The Maine AAP algorithm for assessing the symptomatic student is also available. Oh, I forgot the link there. I have the link in the email that I'll send as a follow-up to this meeting today. But it's also available on the toolkit. It's right in the same section as the pre-screening tool of the Maine DOE COVID-19 toolkit. You can also access it through the Maine chapter of the American Academy of Pediatrics website as well. And for your own knowledge, the COVID data tracker, and you can look at both cases and vaccine data related to COVID in this tracker. It's really pretty cool if you haven't checked it out. It's a little discouraging with the colors that we see, but it is very handy. All right, So COVID-19 vaccines, one of the primary way to make it through all of this is to vaccinate as many as possible. We are going to continue to try to support your schools, Maine CDC and DOE, and connect schools that are interested in hosting, either doing all the work for a school located vaccine clinic, or maybe you want public health nursing to come in and help you or do it all, someone else do everything. That is all available to you. There are lots of different options. The school located vaccine toolkit has been updated to be include COVID and can also be used for any vaccine. This survey that is linked here is a survey that was sent out to your school. It was sent out earlier, I think the end of July, that asks, what have you done already for COVID-19 vaccine clinics? And are you planning to do something else? I would just ask that you take the time to do that, to fill out that survey. And if you feel like you really need to be connected with a partner that you don't know who your partner would be for a vaccine clinic in your area, put that in the box in the survey, and we'll get you connected with somebody. I do want to note that reporting COVID-19 vaccine rates that is now required for schools to do is not a nursing specific task. That is not a nursing task. I see that as a human resources one. It should be coming from either your district office or your central office. If you are asked to be part of that, just remind you that you have access to Impact for student vaccine records, not for adults, and that you should not be looking up any adults' vaccine records unless you have their explicit permission to do so. All right, the last thing I want to talk about is the school public health response team. So SPHRT, if you want to call it that. This is exciting and hopefully will be helpful to all of you. In addition to we still have our DOE contact tracing team that can help they'll be helping on the education side for families directly. The school public health response team is a group of folks that are going to be your go-to contacts for pooled testing questions, registration, support, Binax now testing, working through all of those processes when you have questions and you don't know what to do next. They can help you with connecting to those partners for vaccine clinics, for age-appropriate school staff, maybe catch-up clinics if that ever, if we ever have time to think about that. And what you'll have assigned to your region is a school public health regional liaison. We have 8 out of the 9 positions that we had hoped to fill over the summer. So we're only missing 1. We have a great team. We have a couple of specialists that are kind of helping to organize those teams. And these folks are being trained by me and by Nancy Doobie. She's going to be the coordinator of this team and will be your go-to person for all things COVID. As soon as they are on the ground and running, there will be a way to connect you with those people. All right, so I'm going to stop sharing. And just so that team of the school public health response team, that is a team that is going to be here for you throughout this school year. They are contracted to work until the end of next June. So they will be here for you. All right, I'm gonna look at the questions. So if we have, we know that the pre-screening tool is out. 6-foot distancing as much as possible is a recommendation. There are no requirements for physical distancing. And anything you do is a way to decrease the number of close contacts and potentially decrease the transmission from one to another. So with the Sarah Alert system, the schools can do a notification at the beginning of the school year. You can do a notification with each case, but you're going to be telling them everyone's going to be uploaded into the system. And if you don't want to, you can opt out once you get your first message. So that's the way they're going to opt out. If you are doing pooled testing, day 0 is the day the pool was swabbed or the day of the Binax now. So if you are doing pooled testing and you have a positive pool, the day 0 would be the day of the swab for the pool, because that's the one that was tripped the positive PCR. So that is your day 0. The Binax now is a confirmatory to, that's the way to find out who the positive case was, but the initial positive came up with that pool test. So that's the PCR. You're going to follow the PCR. All right, so pooled PCR testing guidance states that unvaccinated students and staff in pooled testing who are identified as close contacts of a confirmed case, regardless of whether they were a member of the identified pool, do not need to quarantine so long as they are enrolled in pooled testing. Correct. So if someone is enrolled in pooled testing and they are identified as a close contact, maybe because of a cafeteria exposure, and they're not in the same pool, that's okay. That person who was identified as a close contact still doesn't have to quarantine from school or school activities because they were in the pooled testing program. When we're talking about school close contacts and school exposures and whether or not there are exceptions to quarantine, that's always for an exposure that happens at school during the school day when we know that there may have what kind of mitigation measures or what kind of exposure it was. So when we're talking about school close contacts and school exposures, it's what happened at school. If someone is identified as a close contact from a community exposure, these exceptions do not apply except for vaccines and previous 90-day infection. So direct physical contact, I would refer to the definition that is in the glossary. And yes, it does impact sports, football and soccer. So these kids that are bumping into each other, that is direct physical contact. They would be close contacts. Yes. And the DOE contact tracing team is still on board. They've been sort of working all summer long. There's not been a lot of work for them, but they've enjoyed some time off and they are ready to go and ready to be here for you. So with the masking policy, a universal masking policy, Lynn, if my school is fully masking, no one has to quarantine. No, that's not true. So if you have a universal masking policy in your school, you won't be, people that might be close contacts in the classroom exposure would not have to quarantine from school, from their school day. People that are identified as close contacts outside of the classroom, recess, cafeteria, they are still going to be identified as close contacts and they will have to quarantine. Sorry, I have to stop my phone from ringing. All right, so with the close contact list and the contact tracing template, there's an instruction at the top of the template, and I'd ask you to follow that. So you are not going to include people that are vaccinated or people that are in their 90-day previous exposure, 90 days previous infection. You will not include them on your contact tracing list. Likewise, you will not include someone who is enrolled in pooled testing. Thank you for the reminder on vaccinated individuals. do need to quarantine if you have any symptoms start, right? So anyone that is identified as a close contact and has one of these exceptions, if they develop symptoms, they need to get out of there. They need to go home. They need to start isolating, and they need to get tested. The masking policy, universal masking policy, is talking about and identifying close contacts in your classroom. It does not matter if you do not have masks at recess. That doesn't affect what you're doing in the classroom. So community programs that are closely linked with the school, we don't have any jurisdiction over community programs. We can't exempt them from pooled testing exposure. We can't exempt them from things because they are community events and not related to school. As far as the Delta variant being more transmitted, you're right, it is concerning. We are following the US CDC definition, and I would assume that they are following that closely and will change guidance as needed. It has not changed at this point yet. An isolation room is not a requirement. However, I would say that there is a strong recommendation that you have some place that you can separate symptomatic people from healthy operations of your school. That seems to be a very good lesson that we learned from the pandemic, and I think that we should continue it. So some sort of separate space to isolate the symptomatic from the healthy diabetics and healthy otherwise healthy kids that have to come in to the school nurse's office. So under table 2 for the quarantine exceptions, there is that confusing inclusion of staff, and that's just related to the masking. A person that is fully vaccinated, if they're a student or a staff, they do not have to quarantine from anything. They should be informed of their exposure, and you can recommend that they get tested 3 to 5 days after exposure. You can recommend that they wear a mask until they have that negative test, but those are not requirements. They are just recommendations. The reporting form doesn't have a place to put in the positive person's name or date of birth. How can you confirm a case? Okay, so we need to make sure we have 2 different forms that we have for you. One is the case reporting form, and that is an online web form. That is where you're putting in the case information. You're putting in the case name, the case date of birth, and the information about the positive case. When you are submitting your close contacts on the contact tracing template, we do not want the case name on that form. Our contact tracers should not know who the positive case is. That they don't need to know that information, and we don't want them to know that information. So the case reporting form that's where you put the case name and the date of birth, and that gets confirmed through Maine CDC. When you submit your contacts, your close contacts, the name of the case does not go on that. You can either use the initials or you can use the NBS number that is provided to you when CDC confirms the case. All right, so my district is doing strongly recommended masking with parent decision. If a classroom has a mix of masked students, what happens if a positive case is identified? Does the entire class have to quarantine? In that situation where you might have some people masked and some people not, that is not a universal masking policy, right? So that allows some personal choice. You're going to be identifying close contacts as those within 6 feet for 15 minutes or who have had direct physical contact. there time for direct physical contact, or is it any at all? Meaning if a player playing on an opposing team has a positive case, any of our players who could have had contact at all would be quarantined. Is this an out of school quarantine? Yes. So if they're in a sports setting, most of your players that are actually playing on the field, so say with soccer, if they're actively playing on the field and they have some direct physical contact or within 15 minutes, within 6 feet for 15 minutes, they are going to be identified as a close contact. Yes. And they will need to quarantine. Yes, that is an out of school quarantine, unless your school is doing pooled testing and they are part of that pooled testing program. So question about mitigation measures for band and chorus. So that's not part of the standard operating procedure. That is, that's general, from the general recommendations. There aren't anything, I don't think there's anything specific from US CDC. I'd point to the US CDC guidance, and that's all I can point to for mitigation measures. That goes for sports mitigation measures too. I believe that the MPA, when they give out their recommendations on, hey, we really think that everyone should mask when they're playing or when they're on the sidelines, that's their mitigation measures. All right, does pooled testing only exempt students from school or school-related quarantine if they are exposed in school, or does it also exempt them from school quarantine if they are identified as a community or household contact? Again, any of these exceptions for school are from school exposures, and that includes pooled testing. So if they are identified as a close contact from a community exposure, they will still need to quarantine from school. In the SOP, if a close contact is identified, the student can remain at school until the end of the day. This is okay. It is not required. If you can, if you're able to inform the parent and the parent can come pick them up, fine. If you can't, if the parent cannot, or you choose as a district, you choose to just do this at the end of the day, that is okay. Yes, they can remain in school until the end of their school day. There is no requirement for any physical distancing, even at lunch. Everything is a recommendation. So as much as you can spread out is good. All right, question, are we supposed to be testing all close contacts that are not in pooled testing before sending them home for quarantine? So this is a really good question, and I want to say two things. It is an option for a school to use their BinaxNOW tests to test close contacts before they get sent home. That is an option. It is not a requirement because that's a lot of work. So that is an option for schools to do, but it is not required. You can also test, use the BinaxNOW test. Maybe you would want to just use it for staff close contacts. This is a change from last year where the Binax is allowed to, you may use the BinaxNOW test for close contacts students before they get sent home to quarantine. For consent forms for pooled testing, this is really a pooled testing question. If you want to work on a different consent form, you'll have to work with the vendor themselves and determine what's the best way to move forward. I'm not going to get into pooled testing. All right, so if the students are masked and 3 feet apart within the classroom, and at least 6 feet apart when unmasked and eating, and don't touch each other, and don't ride the bus, come within 6 feet of each other during recess, then theoretically, there would be no close contacts identified within the school day. I think I can agree with that, Therese. All right, I'm going to skip the MPA. there's a question about individual vaccine status of students. Will the administrators have that information? You, as a school nurse, you can look up student vaccine records. Your access is to access the requirements, but you have access to the record. You can look at the record and find the vaccine status of students. Bus exposures will be identified, close contacts will be identified on a bus, even with the universal masking. Masking is a mitigation measure and will hopefully decrease the number of people that end up with COVID if there was a positive case, but you will be identifying close contacts on a bus. So however, the best way to find out where people were sitting so that you don't have to quarantine the whole bus is if with assigned seating or with a camera, which can be time consuming. If a vaccinated individual is a close contact and becomes symptomatic, then they get a test. Yes. If the test is negative, can they return to school, or do they need to complete a 10-day isolation? I think that's a pretty, I don't have a good answer to that question. I would refer that question to CDC and have them have somebody consult with Maine CDC. So if universal masking at school, how can we be sure there is no direct physical contact within the classroom? Students would need to remain in seats for the entire class period, correct? To prevent any physical contact. I think that the understanding is that in a classroom setting, kids are not they're not perfect, right? So, and masks aren't going to be, they might be down underneath the noses, or someone gets up and goes and sharpens their pencil, and there is movement in a classroom. If you can say that there was no direct physical contact, yes, and they were, it's that 3 feet. So you still have to identify close contacts within 6 feet. But it's okay that there is some movement within the classroom. The mitigation measure is that extra layer of the masking. The contact tracing template is not exactly the same as it was last year. It has some updates to it. It's basically the same, but basically the same as last year. Good point. Delete for page 5 of the SOP describes the classroom exemption if your school is universal masking and if a minimum of 3 feet physical distance is maintained. And I had not mentioned that, and I'm sorry that I failed to mention that, but there is that minimum 3 feet distance in order to use that masking, that exemption for quarantine. And the physical distancing in the classroom, that exception to quarantine is only if you have a universal masking policy. So the question is, how do you have to do a case reporting form if the positive case is confirmed by a doctor's office or a clinic? Yes. So we don't know how long it takes for the doctor's office to report the case to Maine CDC. If the parent tells you about a positive case, it's really it can speed things up. If you notify us through the case reporting form, it can actually speed up the investigation process. So we've really it's highly recommended that if you are told about a positive case, yes, please use the reporting form, even if you didn't do the test at school. With the Binax Now tests, just can we use the Binax test to test a child who may have minor symptoms and then return them to class if negative? I would say no. They should really go home. If they have symptoms that you needed to test them, then they should go home. If it's negative, then they can come back when they feel better, right? They can come back the next day if they didn't have a fever, if they're improving. So yes, I would still send them home for that day, but they can come back. They wouldn't have to wait for another test. If a student athlete is exposed during a practice or game but participates in pooled testing, they do not need to quarantine. If a student athlete, so I'm going to read it again, but I'm going to put in some other words. If a student athlete is exposed during a school-related practice or a school-related game and participates in pooled testing, they do not need to quarantine. That's correct. So it has to be a school-related practice, a school-related game in order for that quarantining thing. Pooled testing is not related, that 30% enrollment is not related to, connected at all to the benefits of using pooled testing anymore. That was from the spring. That has changed. Any testing is better than no testing. So if there was a positive case in the lunchroom, would you contact trace 6 feet around the student? What if there was assigned seating? You would identify those within 6 feet of the positive case. If you've got kids more than 6 feet apart in the cafeteria, then you wouldn't have to identify close contacts. All right. This is a good question. If we submit a positive case, if you submit a report, a case report, do you need to wait for the NBS number to do your contact tracing and notify those close contacts? You do not. You don't need to wait. What we found last year was that the cases that were reported through our form were 99% of the time they were confirmed. So Maine CDC is fine with you moving ahead. And if needed, we can say, sorry, there was a mistake here. But yes, don't wait for the NBS number to do the contact tracing. You can just work through the case that way. All right. If it is a community exposure, vaccination still provides a quarantine exemption, right? Yes, vaccination is your key. Vaccination will get you out of any quarantining situation. Yes. That's part of the reason we really need to encourage vaccination for as many as possible. Now, I know that there are so many more questions in the chat, and I will go through them and see what we have addressed and what we haven't. But I'm pooped. So I'm gonna end our meeting, and I will be sending the recording link to this. You can probably find it if you look on the DOE YouTube channel. You will be able to find it before in an email, but hopefully it will go out in the next half an hour. I really hope that you will have a good year and do our best to deal with things as they change. I'm excited about the support we have through the school public health response team and look forward to introducing them to you. So have a wonderful day, and we'll see you soon. There will be another office hours coming soon, I'm sure.